Hi, Devin. I'm Don Marie. I'm going to be your dental hygienist today.
Hey,
How you doing?
yeah, I'm pretty good.
Okay. I have here that you're 65.
Yep,
Okay, great. And this is your first visit with us, correct?
that is correct.
Okay. When was the last time that you saw a dentist or had your teeth cleaned?
Oh, it's been a while, a couple of years.
Okay. Do you have, I just have some screening questions I have to ask here. Do you have any of the following diseases or problems?
Okay.
Do you have active tuberculosis?
No.
Okay, good. Persistent cough greater than a 3-week duration?
Yeah.
Yeah, tell me about that.
Well, I got a cough all the time, you know.
Okay.
I've been smoking since I was a teenager. So
Oh,
I pretty
okay.
much I just cough.
Okay, so how old were you when you started smoking?
I was 17.
Okay. All right, and how many packs of cigarettes a day do you smoke?
One.
One, okay.
Yeah,
All right.
pretty much.
Okay. And does this cough has been going on for about how long? All the time or?
I mean, pretty much forever since I've been smoking.
Okay.
You know, just.
Okay. And do you ever bring anything up? Is there ever any?
Oh yeah, sure.
Yeah.
You know,
What does that look like?
in the morning it looks like it's its own creature.
Oh, okay. Does it ever have what it looks like to have any blood in it or anything like that?
I don't think so. I mean, if I get to coughing for a while, maybe just a little bit, but I think that's just my throat.
Okay. Have you had a serious illness or an operation or been hospitalized in the last 5 years?
Nothing serious, no.
Okay. Are you taking any prescription medications?
Yeah, tons.
Okay, so tell me about those. Like, what do you take them for?
Blood pressure, cholesterol, inhalers.
Okay, tell me a little bit about the inhalers. What are you taking those for?
Well, I got 2 of them.
Okay.
And one I take a couple times a day, and the other is just in case I have an emergency.
Okay. Do you have asthma or COPD or some other sort of respiratory thing?
They said COPD, but, you know, I'm not one of those people that goes around with the oxygen tank. I don't do that.
Okay. Okay. And have you ever had to use oxygen?
Yeah.
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 Okay. Do you use it at home or?
No, they've had to give it to me when I got sick a couple times. That's about it, though. It's, you know,
Okay.
you get sick, you can't breathe, and then
Okay.
you got to go and get treated.
Okay. How about allergies? Do you have an allergy to anything, or you ever had an allergic reaction to something?
No.
No. Okay. When was the last time you used the inhalers?
I used one this morning.
Okay. Okay. How about have you ever had a joint replacement, a total hip, or a total knee, or an elbow, or a finger, anything like that?
I had my knees done. Yeah, they just, what they said is they scoped them.
Okay. Okay.
But that was years ago. They did them one at a time.
Okay. Let's see. How about cardiovascular disease or chest pain? Have you ever had any of that?
Not really.
Okay. Never had any heart issues or?
No.
Okay.
I mean, they always warn you about smoking and
Okay.
hearts and stuff, but.
Okay. How about any other substances? Do you smoke pot or do you take any other drugs that are not prescribed to you?
Well, recreationally, I smoke a little pot and drank, beers.
Okay. And so how many times a day or in the past 24 hours, how many alcoholic beverages did you have?
I had a couple beers last night.
Okay. All right.
That's it.
And how much do you typically drink in a week? Like how many beers would you say you have in a week?
Well, I'll buy a 12-pack and, once a week.
Okay. Okay. How about any autoimmune diseases or arthritis?
I don't even know what autoimmune is, but no.
How about any history of cancer, you or any of your family?
Excuse me, sorry.
Okay. Are you having trouble breathing right now, or any chest pain or anything like that?
I think I'm just getting a cold.
Okay.
There's a couple of them going around right now.
Yeah. And how about are you having trouble sleeping at night with that breathing sort of stuff going on?
Well, the wife says I snore like crazy. She says that she has trouble sleeping, but I don't know. I wake up a bunch, but
Okay.
I go right back to sleep.
Okay. All right, well, has a physician ever asked you, has ever recommended that you take antibiotics or anything before you have a dental treatment? Oh,
Excuse me.
sorry. Oh, let me get you a tissue or something. Devin, I think I would like to just stop for a minute here and check your oxygen. Ooh, are you okay? Let's take a look here. Let's take a look, yeah.
Okay.
All right, your oxygen saturation is like 88%, so that's really kind of low. Do you have your other inhaler with you?
I don't. I left it at home.
No? Okay. All right, well, I want you to, let's just sit you right up, okay? And what I'm gonna do is, I'm gonna give you, one of our inhalers, some albuterol, okay? And I want you to take 2 puffs and let's see if we don't have you do a little bit better. You know how to do that?
Yep, I do.
Okay. How you doing?
There's a little bit of.
Okay. Your oxygen saturation has come up a little bit. It's like at 90%.
It's about where it usually is.
Yeah. How well do you think you're going to do if I'm working in your mouth there?
I don't know. I think maybe we should skip it.
Okay. So why don't we do this? Why don't we reschedule you? And what I would suggest is, number 1, that you check in with your doctor because you said you've had that cold. And number 2, that you should probably start carrying that rescue inhaler with you.
Yep.
Okay?
Okay.
All right. Is your wife here? Can she drive you home?
Yep. She's out there waiting.
Okay. You sit right still. I'll get her to come in, and
Okay.
you don't need to get up until you feel better, okay?
Okay.
And the scenario.